Why your migraine medication might be failing. Common triptan pitfalls. For decades, triptans have served as the gold standard for abortive or acute migraine treatment medications designed to stop an attack in its tracks once it begins. However, many patients find themselves frustrated when a dose provides only partial relief or fails to work entirely. When this happens, the problem often isn't that triptans are ineffective, but rather how they are being used. Understanding the nuances of timing, absorption, and dosage can be the difference between a debilitating attack and a return to normal functioning. Understanding triptans work by activating serotonin receptors, which helps reduce pain signals and constrains the dilated blood vessels in the brain that contribute to migraine pain. They are available in various forms, including oral pills and disintegrating tablets, nasal sprays and powders, injections, shots. Commonly prescribed options include sumatriptan, Imitrex, rizatriptan, Maxalt, zolmitriptan, Zomig, naratriptan, Emerge, almatriptan, elatriptan, Rilpax, and fravatriptan, Frova. 4 common reasons triptans fail if you aren't getting the relief you expected. One of the following 4 factors is likely the culprit. Poor timing. The most common mistake is waiting too long to take the medication. Triptans are most effective when they interrupt the migraine process before it reaches its peak. Expert insight. Waiting to see how bad the headache gets before taking your dose can render the medication ineffective for that specific attack. Incorrect dosing. Dosing errors often happen unintentionally. Some patients may be on a dose that is too low for their specific needs, while others may attempt to stretch their prescription by splitting pills. This is a risky strategy. Taking less than the prescribed amount may fail to stop the migraine, leading to a recurrence of symptoms later that day or the next. Absorption issues. Gastric stasis. Migraines don't just cause pain, they can actually slow down your digestive system, a condition known as gastric stasis or gastroparesis. The problem? If your digestion slows down, an oral pill may sit in your stomach without being absorbed, or it may be lost entirely if you experience vomiting. The solution? For those with severe nausea or rapid onset migraines, doctors often recommend nasal sprays or injections, which bypass the digestive tract and enter the system much faster. The wrong triptan. Not all triptans are created equal. They differ in how quickly they work, how long they stay in your system, and their side effect profiles. Pattern matching. Certain migraine types respond better to specific drugs. For example, menstrual migraines may respond more effectively to fravatriptan or naratriptan, which can sometimes be used preventatively during predictable cycles. The risk of medication overuse. Headache. There is a delicate balance between treating an attack and over-medicating. If you use triptans more than 10 days per month, you run the risk of developing medication overuse headache, MOH. This creates a vicious cycle where the medication itself causes headaches to become more frequent and constant. When to seek preventive care. If you find yourself needing rescue medications frequently, it may be time to shift from treating attacks to preventing them. The rule of thumb: if you are experiencing more than 6 headache days per month, consult a neurologist or primary care provider about preventive treatments. These medications aim to reduce the overall frequency, severity, and duration of attacks, ultimately reducing your reliance on acute treatments like triptans. Summary: to maximize the effectiveness of triptans, take them at the first sign of symptoms, adhere strictly to your prescribed dose, and consider alternative delivery methods like nasal sprays if you struggle with nausea. If your migraines are frequent, prioritize a conversation with your doctor about preventive strategies to avoid medication overuse.